Hello, I'm Carl Newton, and I serve on the Colorado Healthcare Ethics Forum Board. I want to welcome you to our preview of our 10th annual conference to be held May 22nd and 23rd, 2024, and will be held at the Wilshire Event Center in Denver. Our theme this year is healthcare equity, ethical challenges, and solutions. The conference will focus on difficult ethical challenges and solutions that advance the fair and just delivery of healthcare to underserved and underrepresented populations. Today, I'm excited to have a conversation with one of our speakers, Dr. Jeffery Sankoff. Dr. Sankoff is a board-certified emergency physician working at Denver Health. The title of his presentation is Barriers to Quality Healthcare and Emergency Physicians' Perspective. Welcome, Dr. Sankoff. We are so glad to have you with us. Would you tell us a little bit about your background and your awesome and challenging work?
Absolutely. So I'm originally from Montreal in Canada, where I undertook my training first in medical school at McGill University, and then I did a residency in emergency medicine and a fellowship in critical care. My wife is a pediatric surgeon, and we both moved down here to Denver in 2003, where we began our practice. She's been working as a pediatric surgeon here, and I as an emergency physician for going on 21 years. And I have worked most of that time at Denver Health Medical Center, where I have served in both education capacity, teaching residents, medical students, and of course in a clinical capacity, taking care of the underserved population of Denver in our social safety net hospital. I also work various other responsibilities clinically and administratively, one of them being as a member of the ethics committee for the hospital.
Wow, so that they keep you busy. Would you share with us a little bit about the focus or purpose of your presentation?
Yeah, I think that as somebody who's coming from Canada, I've had an interesting perspective of different healthcare system here, and then of course where I originally did my training. And access to healthcare is a problem no matter where you go, no matter what system you work in. But there are particular aspects of the way this system is crafted here in the United States that lend to real significant barriers. Those can be economic, those can be related to just where you live, geography, and they can be socioeconomic, as I mentioned, but also just related to who you are as an individual, where you've come from, and where you're going. So there are just so many things that lead to problems with getting people the kind of care that they deserve and that they need. That as an emergency physician, where we serve as kind of the fail-safe, the outlet valve for all things, we end up seeing everyone, and that too often is a microcosm of the failures of the system that we all work in.
What can participants expect to learn or benefit from attending your presentation?
I hope to be able to give participants some food for thought, just not really looking to persuade anybody about anything that earth-shattering that can change today or tomorrow, but rather just open their eyes to what's going on, I think, underneath all of our noses. The healthcare system is not functioning to the benefit of the majority of our patients. And we see that in the emergency department, I think, more than anybody else does. And so it's my hope to kind of open people's eyes, to make them see what's going on so that they can give some thought to those unfortunate souls, but also to how we might better the system as a whole to benefit everyone.
Is there anything else you would like people to know, especially about the challenges that you have in your presentation?
I think most important would just be to come in with an open mind. Don't come in with any preconceived notions. There's no question that healthcare in the United States can often be the best in the world, but it tends to be that way only for a select few. And if we're fortunate enough to be in that few, then we may not necessarily see what's going on for others. So I would ask only that people be ready to embrace the potential or the possibility that what they see is not what everyone sees.
Well, it sounds like you have an excellent and very interesting talk, especially being able to share some of the challenges and the complexities of decision making that you encounter in the emergency room. Thank you so much for taking time out of your busy schedule to give us a sneak preview of your talk. And that talk is Barriers to Quality Healthcare and Emergency Physicians' Perspective. We encourage everyone to go to the Colorado Healthcare Ethics Forum website at www.coloradoethicsforum.org for more information and registration details for the 2024 CHEF Annual Conference to be held May 22nd and 23rd, 2024. Space is limited, and we encourage you to register today to get the best rates. And we hope to see you there. And again, thank you, Dr. Sankoff, for taking time out of your schedule to be with us today.
It's my pleasure, Carl.